Hi all. Hi all, welcome back to Nursing Guru. So in this video or in this live session, mainly we are going to know about our academics, as you all very much excited to attend our live sessions, and we can start our today live session regarding overview of anatomy and physiology. Very first, I would like to welcome one and all that you can grab a knowledge which is related to anatomy and physiology who are studying in first semester BSc nursing. Okay, so this may help you to know knowledge, and it will be acts as a basics for your course. Okay, so very first we are going with so, very first, when it comes to this academics, we are mainly dealing with the anatomy and physiology. Okay, all of you know that. So already we have done lots of videos on subject. Okay, subject overview and syllabus overview, especially we have done lots of videos. Who are not yet watched, please kindly go through our YouTube channel or in our application, download our application. You will get all those videos and you watch it, and definitely who are fresher, definitely you will get the basics going to be clear for you. And very first today's sessions, already who are watching the thumbnail, we come to know that we are going to rendering a session, live session on applied anatomy and applied physiology for first semester BSc nursing. Okay, so it is overall the live session is all about the syllabus and especially the subject review, not at all going to be briefly explaining the each and every unit, but we are going to provide you a guidelines or the route map to get an idea of this particular subject. Okay, so this is the thing we are going to do in this live session. Okay, so let us start. Who are watching, you can do a chatting in the live chat, and whatever the doubt you have you can ask me. Okay, so we will reply to your questions. So let us start, students. The very first we have first year means one brief introduction I would like to give you. First year means we have a subjects like applied anatomy and applied physiology, as well as we have that applied psychology and applied sociology. Okay, so these are the things majorly we are going to study and we are going to attend for the examination. Be clear with this. Okay, the next thing is that one more subject is there, that is foundation of nursing or fundamentals of nursing or nursing foundation, whatever you can call it as, it is same only, nursing foundation. So when it comes to this nursing foundation, part 1 and part 2 will be there. So how we are going to study then this part 1 and part 2? So when it comes to this part 1 and part 2, it is going to be split it out in 2 semesters. Okay, hope you guys are understanding what I am telling. Okay, so which means you are going to study the nursing foundation part first in the first semester and the part 2nd, okay, part 2 in the 2nd semester. Okay, this much is clear. And these two, now you have a doubt, right? Only ma'am said that we had an examination for only 4 subjects, that may be anatomy and physiology and as well as the psychology and sociology. Okay, so then when we are going to write this foundation examination, obviously you guys are getting the doubts regarding this one. Okay, so without lagging, I would like to say this is the very important subject, and it is one of the basic basement for our course. Okay, so for that reason we are keep on studying this one as 2 parts, part 1 and part 2. So in the meanwhile, we are going to supposed to write the examination in the 2nd semester togetherly, part 1 and part 2. It is all about nursing foundation. Okay, so if you have any doubt, you kindly do comment in the comment box. The chat box is yours, and if you have any kind of query will be also there, means you can go through this. Okay, so we will definitely answer to your questions. So we will start today the live session, which is almost regarding the applied anatomy and physiology. Okay, so first we are going to be deal with the applied anatomy. Okay, so this is the syllabus copy. So one by one we can go with this. Okay, so around 9 to 10 units will be present over in this particular subject. Okay, don't be confused over here, because this is one of the very important subject to know by you, because it is a major subject, one of the major subject in the nursing. Okay, so here you can see that we have 10 units, I said. Okay. So before going to start our unit wise discussion, I would like to tell you regarding the subject. Okay, so very first, when it comes to a fresher, you can't know that what is anatomy, what is physiology. See, suppose you are first standard to second standard, if you are going means you can't know, right? Everything will be looks like a fresh in your childhood. The same thing that you may going to experience once you choose the nursing. Okay, so when it comes to this one, you are definitely going to get a bit of confusions and lots of thoughts process in your mind. What is this, how the subject will be. Okay, so if you are very genuine in your study, definitely this makes you to be happen in your mind and brain, that it may start to think about how the subject will be, how we are going to be study, and what are the strategies we can use. Okay, so those are the things always having the discussion in our mind with ourselves. Okay, so for that we have to be clarify the things what the subject is. Okay, very first we are going to discuss with the applied anatomy. As I said, that applied anatomy, it is the advanced knowledge in the anatomy. Okay, so we are going to get the upgraded version of the knowledge which is in the subject of anatomy. So when it comes to this one, anatomy, so madam is telling anatomy, we are getting the upgraded knowledge, all these things which will be there. But even though now it is the time to know what is anatomy. Okay, so when it comes to this anatomy is a subject. Okay, so it is a study of human body. Okay, so study of human body in structure. Okay, so once again I'll repeat it, the study of the structure of the human body. Okay, so anatomy and physiology are the same, like two faces of the same coin, but one is anatomy which is going to be tells about the structure. Suppose if I am taking a heart or if I am taking a stomach, so stomach is a J-shaped organ. Okay, so which we can see in the alimentary canal. Okay, so that stomach we are going to study in the digestive system. Okay, the systemic organization will be there. Okay, cellular level of organization will be there, lots of things. Now I am telling, I have a knowledge bit about this one, so that is why I am telling. So now you are getting that what is those words and all. Okay, so that's what we are going to study in the first unit. Later I will tell you. So clear with the things, my dear students, which is anatomy means we are going to study about the structure of the human body or the organs. Okay, so what is the shape of the stomach. For example, I am telling each and every organ. Okay, kidney is a bean shaped organ. Okay, so this kind of structure, how it looks. Suppose somebody will come and ask you that regarding a machine, how it looks means you are going to be explain. Okay, so for example, you are buy a new car means suppose somebody will come and ask you how the car will looks means you are going to start to describe, this is in the like color of red, it is very attractive, like that only you are going to start to explain about their structure. Okay, so when it comes to the working, okay, so working means physiology. Okay, so anatomy is clear, we are going to study about the structure of the organ. For example also I have given. Now we are moving towards the physiology. What is then physiology? The physiology which is going to tell us about the functions of the body, human body and its organ. Okay, so when it comes to this functions, so how it will be work. I gave an example how the car will be looks. Now when it comes to the physiology, how the car will works. Okay, how many kilometers it is going to be travel. Okay, what is the comfortable things which will be there in the car. Okay, so what kind of features it is there, what kind of working feature, how does it works. Okay, so that is what we are going to see in the physiology. Don't be confused, the same like that in our body how art works means we can say that it will be works like this. So that is what the working capacity of an organ which is going to be tells by its functions, which is deal with the physiology. Okay, hope you guys are understood about this, the difference between the anatomy and physiology. Once again I would like to tell you that anatomy means structure, and when it comes to the physiology is a function. Okay, so let me have a clarity about this. Okay, so hope you guys are clear with that. And now we can, I said when it comes to the applied anatomy, we have 10 units. Okay, very first we are going to deal with the introduction of the anatomical terms and organization of the human body. Okay, so certain terminologies. Okay, so these are very important. Suppose I am coming and telling you anatomy is that, like is it which is this, that and all I am telling you, can't able to understand, right? So I have to know what it is, what is the meaning of the particular thing. That is the major thing you are going to study in the first unit, that is what introduction to anatomical terms and organization of the body. Okay, the cellular level organization, okay, systemic level organization, all the levels of organization you are going to see. Later we can discuss about that too. So here introduction to anatomical terms related to the position and related to the plane and related to the movements. Okay, all these things we are going to be see. Related to the position, we are going to see that anterior. Okay, anterior means front side of the body. Okay, and posterior, superior, inferior. Superior means apex. Okay, top of body. So like that we are going to be see like inferior, medial, lateral, proximal, distal, superficial as well as deep and prone we are going to see in the plane. Okay, so which is going to be seen the positions of the anatomy. Okay, so which is going to be study in this particular unit. Okay, in this particular live session mainly we are going to discuss about the particular things what it will be there. Okay, so tomorrow onwards particular sessions we are starting in our live stream. So definitely you guys are get good benefit of this live sessions in our channel. So every day keep attend our live sessions by 5 o'clock. Nowadays you know that what is the circumstances which will be there due to the war. So hope you guys are getting the benefit of this also. And next one, anatomical planes, axial, transverse, which means transverse means horizontal plane. Okay, so the next one is sagittal. Sagittal means vertical. Okay, so anatomy is nothing but the dissection. Okay, cutting. So for that cutting of the human body or the part we are going to be upgraded version we are going to especially study in the anatomy. So that majorly we have to know all these terminologies to deal with the anatomy. Okay, so next one is movement, flexion, abduction, extension, adduction, medial rotation and lateral rotation, inversion, eversion, supination. Okay, so all these things which will be acts as a basic terminologies of the anatomy. Okay, so this is all about the terminologies. Okay, so first one we have talked about the position, the second one we have talked about the planes, and the third one we are going to be talk about the movements which is related to the terminologies. Okay, now we can see the organization. Okay, so the organization which may be due to the cellular level. Okay, so the organization will be there, so that we are going to deeply study. Then tissue, we are going to know about this, all the things which is related to our bones also, musculoskeletal system also, everything which we are going to be studying this particular human body organization, cell and its structure, everything. Okay, so this is all about the first unit. Next thing we are going to see about the respiratory system. Okay, so the respiratory system, when it comes to the respiratory system, hope you guys are clear with this. If you have any doubt you can do comment. And when it comes to this one, right, respiratory system, the respiratory system is one of the important system you have to know in the anatomy. So again I am explaining that in the anatomy we are going to supposed to know about the structure of the lungs. Okay, so upper respiratory system, lower respiratory system, like pharynx, larynx, okay, everything, okay, everything which will be present in the trachea, all those things we are going to study in the respiratory system. The next one is muscle of respiration. Muscles of respiration also you are going to see here, and how it will be application we are doing in the nursing. Okay, so that is also one of the important. Okay, mainly you are going to focus on the upper respiratory and lower respiratory and all the organs, and as well as mainly deeply going to discuss about the lungs. Okay, so and the muscles of the respiration we are going to be saw in this particular second unit. Next one is the third unit. The third unit which is related to the digestive system. Initially I said that the stomach. Okay, so the structure of the alimentary canal, you have seen the alimentary canal diagram. Okay, so from your high school and all, higher education section, from that 8th 9th standard onwards you are seeing those things. So there from we are seeing especially regarding the alimentary canal and accessory gland, accessory organs of the digestion. Okay, stomach, esophagus, duodenum, small intestine, large intestine till rectum we are going to be supposed to study in this particular digestive system. From mouth to rectum we are going to be study. Okay, so all these things, how the stomach will be look like, what is in the shape of the stomach. Okay, suppose I can say that stomach which will be in the J shape. Okay, so that is why when it comes to anatomy, the shape, size, okay, locations are matters a lot. Okay, while writing in the answer also you have to write in such a way. Okay, so this is all about the digestive system. Third unit or finish. Okay, next we can move to the circulatory and lymphatic system. Okay, so here we are going to mainly know about the blood. Okay, so blood and the blood vessels and the blood components, and here we are going to see about this especially heart. Okay, so there is always a correlation between the circulatory system and lymphatic system we are going to study togetherly. We are going to mainly, one second, sorry, and the next thing we are mainly going to be see about the blood and its components and blood vessels as well as the lymph nodes, and along with that mainly focusing on the heart. Okay, the chambers of the heart and how the heart will be. Heart is a halomuscular organ. Okay, so the 4 chambers will be there, ventricles, and so all those things we are going to be see here. Okay, so fourth unit is also over. Okay, so we come to know, we get an idea, we are going to study in the fourth unit which is related to the circulatory. Circulatory means the blood circulation. Okay, so the blood circulation which will be done through heart. Right, so all these things which we are going to study in this particular unit. Okay, so that is all about the anatomy. Okay, so the next one is endocrine system. Endocrine system, it is all about hormones. Okay, so we are going to study about the various glands which will be present in our body. Okay, so hypothalamus which will be present in our body, there we are going to study mainly about the pituitary gland and pineal gland, and we are going to study about the thyroid gland, parathyroid gland, and pancreas, adrenal gland. Okay, so all the glands which is going to be secrete the hormones, and those are the one of the very important system you should know thoroughly in the your course. Okay, so that is one of the very much important unit also. This is the fifth unit, endocrine system. Okay, we are going to supposed to study about the glands of the human body and the secretions of the hormone produced by the several various glands. So, hope you guys are understood with the fifth unit. Now we can move towards the sixth unit. The sixth unit we are going to study about the sensory organs. Okay, the sensory organs, the structure of the skin, eye, ear, nose. Okay, so and the tongue, application and implications of this in nursing. Okay, so all we are going to study about the eye, ear, nose. Okay, so all these things we are going to study in the sensory organs, skin also. Okay, so why it is very important when it comes to this, all the systemic wise units what we are seeing when it comes to second semester or third semester, you have a one more important subject, that is adult health nursing. From that time it may be very important to know anatomy better, to catch the adult health nursing. Okay, so now you are thorough with the anatomy and physiology. Definitely we hope you guys are getting a very good of knowledge while studying the adult health nursing. You are catching the exams or catching the lessons or the units very easily if you know better the anatomy and physiology. So anatomy and physiology acts as a base for adult health nursing. Okay, so all the disease condition which is related to our body systems, you are going to be study in the particular subject. Okay, so let it be there itself. And next thing I am supposed to tell about this sensory organs I have said, okay, already, the skin, nose, eye, ear, all the things which is going to be studied in the sensory organs. Next one is 7th unit, musculoskeletal system. The musculoskeletal system, muscle plus skeletal. Okay, so you are going to study about the muscles. 630 muscles will be there, and as well as we are going to study about the bones. Okay, so togetherly which is called as a musculoskeletal system. Okay, so there we are going to study about all the positions and the bone, types of bones and the structure of bone. Okay, long bone, short bone, sesamoid bone, like flat bone. Okay, all these bones we are going to study under this one, and we are going to study about the muscles and joints also. Okay, synovial joint and all, which will be the one of the important topics which comes under this particular unit. So later on we are when it comes to examination sessions, by the time we are telling the important question also. So please do subscribe to our channel and keep on watching our videos also. And the next thing, muscular system will be there. Okay, types and structure of muscles and muscle groups we are going to study. The principal muscles like deltoid, biceps, triceps, respiratory, abdominal, pelvic. Okay, all over the body 630 muscles will be there. All the muscles irrespective of their system and all, you are going to be study. Okay, so the next one is renal system. Okay, the 8th unit is renal system. When it comes to the renal means we are going to study about the kidneys. Okay, so the renal system which is going to deal with the kidneys, the structure of the kidney, ureter, bladder, urethra. Okay, so all these things we are going to study about in the renal system. Okay, so the next one is reproductive system. Okay, this is also one of the very important system you are going to be study in the first semester, male reproductive and female reproductive togetherly. So all this about the reproductive system, structure of the male reproductive organ, female reproductive organ, uterus, ovaries. Okay, their structure, size, shape, everything you are going to be study here. Then nervous system. Okay, so the nervous system, not be nervous. Okay, so the nervous system means we are going to study about our brain and the neurons. Okay, especially we are going to be study about the neurons and sensory nervous system, and we are going to study about the peripheral nervous system. Okay, all these and autonomic, peripheral and sensory. Okay, so all these central and peripheral and autonomic, all these three system we are going to be study. And structure of the brain, spinal cord, majorly we are going to study about the spinal cord and cranial nerves. Okay, so and we are going to see about this functional areas of the cerebral cortex. Okay, all these things what they have mentioned here, we are going to be studying in this 10th unit. Okay, so now we come to know that how many units will be there in the anatomy. Okay, so I am not going to be deeply discussing about the physiology, but I will tell you how much it is there as a syllabus. Okay, so So here only one changes will be there. We can see all the systems which are going to be studied, and along with that this blood circulatory system what we have done, no, there only we study the heart also in anatomy. But when it comes to the physiology, cardiovascular system and the blood, okay, so it is going to be divided. So those two are mainly going to take a part in this particular physiology. So in the anatomy total 10 units will be there, in the physiology total 11 units will be there, okay. So we are winding up that what is the subject it is and what is the syllabus which will be there particularly for this subject, okay, that we have seen, okay. Now I will give a brief note on this particular thing, okay. So anatomy. Anatomy means structure, physiology means functions. So here we are having total 10 units. Here we have 11 units. So the next thing what we have going to be study the QP, and here also I am going to tell about the QP, question paper pattern, okay. So all these things we have seen in the syllabus copy about this subject, particularly anatomy which is going to be study about the structure, that is clear, okay. The physiology which is going to tell about the functions of the human body and its organs, okay, that is clear, okay. Here we have the 10 units, okay. So introduction to the anatomical terms and all, okay, all those things which we have, and again we have that like all the systemic level of organization in our body, what it will be there from head to toe, that structure we are going to be study, okay. Digestive system, respiratory system, renal system, circulatory system and lymphatic system, endocrine system, nervous system, okay, all these things we are going to be study here, okay. So total 10 units. The next one is functions. When it comes to the functions, we have around 11 units. Here what it will be happen, the circulatory system which is going to be divided into cardiovascular as well as the blood, okay. So all these things you are going to be study. So that is why it is going to be like adding of the one more unit which will be in the physiology, okay. All these things are about this one, and now we can see that question paper pattern, okay. So this is very important. As a fresher you should know that what is the question paper pattern will be there, okay. So very first, okay, long essay will be there, okay. I will write long essay, one second. Short essay, short answer, MCQs, okay. The long essay which is carried 10 mark, short essay 5 mark, and we had a 2 marks question and which is 1 mark. Okay, so totally 39 and plus 38. Okay, like this for both QP. This anatomy, okay, I am speaking about anatomy here. Okay, so when it comes to this anatomy, we have a question, pattern of questions were like this, and we have to know before going to examination the total marks, which is anatomy and physiology 39 plus 38, like that they are going to be divide, and 1 marks is going to be vary in both of the exam. Most of all time that physiology is carrying 39 marks and anatomy is carrying 38 marks. Okay, so like that it will be there. Okay, only 1 mark variation will be there, that you find it out. And here the long essay means what you have to like how the question will be and what kind of answer you should write, that you have to thoroughly know. In one more session we are going to supposed to tell about that also. Okay, this is all about the QP. Here 1 into 6 MCQs will be there when it comes to the MCQ, but in physiology 1 into 7. Okay, the only 1 mark will going to be vary in the question paper. Okay, so this is the same pattern for the physiology, only MCQ part 1 question will be more than anatomy. Okay, so this is all about the anatomy and physiology with their syllabus review, and the subject review will be also we had done, and as well as the question paper pattern also we have taught in this live session. So far we have discussed lot of things regarding the anatomy, which gives you a base for knowledge for if you are regularly attending our live session, definitely which will make you to understand better the things in the next class. So we will wind up our today's session. Thank you.